that some of the things that we can do to prevent preterm birth depends on what that risk factor is. So for example, for our moms who have had a prior preterm delivery, we as obstetricians, we kind of divide those into women who lost a baby very early, for example, in the second trimester up until 24 weeks, or women who developed preterm labor after that. The earlier deliveries sometimes happen because that cervix starts to open, even without labor, it just starts to open with the delivery of a baby. And we call that technically cervical insufficiency. And so if a woman has had an early loss like that, she needs to be evaluated, but one of the things we might offer her would be a stitch called a cerclage, which can help prevent that opening up of the cervix that happens sometimes in the second trimester. For our moms where the preterm labor happened after 24 weeks, or even if she developed labor before then, there are several things that we offer a woman to try to prevent a recurrent preterm delivery. And here's where, so many of the basics come into play. Getting into prenatal care early so that we can go through some of these options with her. Be educated about these options so when the doctor, midwife, or provider talk to her about these options, she's aware of them so that she understands why we're offering them. But some of the things that we can offer, for example, is progesterone injections. For a mom who has had an early preterm delivery, if we offer her weekly injections of progesterone from 16 weeks up until 36 weeks, we think it'll reduce that risk of a recurrent preterm delivery by about 1/3. So it can't prevent all of them, but it certainly goes a long way to reduce some of the risks of a recurrent preterm birth. The other thing we offer a mom in that situation is to monitor her cervical length. And we do that from 16 weeks up until 24 weeks. And we do that by a vaginal ultrasound. So we do a vaginal ultrasound, we measure the cervical length, and if that cervical length is very short, then her risk of an early preterm delivery is much, much higher. And again, that's another situation, specifically in that situation where she's had a prior preterm delivery and now she has a short cervical length, we would offer her a cerclage in that setting as well. So there are definitely some interventions that we offer our moms with a prior preterm delivery, but a lot of that depends on getting to us early so we can counsel you, so we can understand what your history was, maybe get your records so we can look more carefully to see exactly what happened, and then those are some of the interventions that we can offer.